Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. According to the U.S. Environmental Protection Agency, radon is the #2 cause of lung cancer after smoking in the United States and is estimated to cause over 20,000 deaths. Many families in the United States are affected by radon, which is why we will be talking about it today. And joining me today is Dr. Clifford Mitchell, the Environmental Health Bureau Director at Maryland Department of Health. Welcome, and thank you for being on our show today.
It's nice to be here, Molly.
So you were here last time to talk about lead.
Yep.
And we are here today to talk about radon.
Yes.
Something just as scary, I feel like.
Well, I think it's scary to people because a lot of people don't understand naturally occurring radiation, and it's something that people hear about, but you can't see it, you can't feel it, and you can't taste it. The only way to know whether it's there is to test for it. So I think for a lot of people it's the unknown because they can't sort of put their hands on it and actually see what it is.
Right, so tell us, let's start off a little bit about your role at MDH and how you're involved in radon.
So I'm the director of the Environmental Health Bureau. The Environmental Health Bureau in the department is responsible for food protection, it's responsible for our Healthy Homes program, and a number of other programs. But I think that the thing to understand about radon, we work very closely with the Maryland Department of the Environment, where the radon program is located. And our role is to help people understand what radon is, why it's a risk, and to help people understand that if they test for it and if they find it and correct it, they can reduce their risk of lung cancer for themselves and their families.
So then let's start off with those questions. What is it?
Sure. So radon, people get concerned about radon because they hear radioactivity. So the important thing to understand about this, first of all, is radioactivity, it's part of nature. There are a large number of elements in the ground and in the air that are radioactive. And what that means is that they give off these invisible particles, which we know as radioactivity. So radon is the product of naturally occurring metals in the ground, including uranium, and it's what's called a decay product. So what happens is that you have this, people think of uranium, obviously it's a metal, but as it decays and it gives off these invisible particles, it transforms from a solid metal into a gas. That gas is radon, and that radon, which is a gas, still is heavier than air, and that's important, we'll talk about why, but it gives off what's called an alpha particle. An alpha particle is just a heavy part of radioactivity. So let's just talk about that for a minute. So you have this radon gas, and it's giving off this alpha particle. Now the alpha particle is like a big, heavy, slow-moving radioactive thing.
Okay.
And the important thing about that is that if it's outside of you, it's totally harmless. And the reason is because think of it like a bowling ball. It's a bowling ball. It's big and heavy. It moves kind of slowly, and it gets stopped very easily. It can't even penetrate your skin or a sheet of paper. So radon outside of you is fine. It's harmless, and it's in the air everywhere. So it's part of our environment naturally. The problem we get into is in a home, if the home has radon gas in it, and we can talk about why that happens, it tends to be down at the bottom oftentimes because it's heavier than air. And if you breathe in that radon and it gets into your lungs, what happens is those big, heavy bowling ball particles, those alpha particles, can actually hit your lung tissue. And that can become a problem because that can actually trigger the start of a lung cancer.
Okay.
So the important thing about radon is that outside, not bad. Inside is where we get concerned about it, which is why we try to get it out of homes where it's found.
So homes are usually the only place where people would be exposed to radon?
So remember I said it's everywhere in the
Right.
environment. We're exposed to it from the moment we're born, but at very, very low concentrations. The problem you run into is, let's say that you have a house and it's got a foundation and it's got some cracks in the foundation or a hole for a sump pump or something else like that. So the radon gas, which is being generated in the ground where the uranium is, floats up slowly, seeps through those cracks into the foundation and into the bottom of the house, and then it just tends to stay there.
Right.
And if the foundation, if that cellar, for example, is not well ventilated, it just sort of sits there. So if you go down into the basement, or if you spend time in the basement, your chances of breathing more radon into your lungs gets higher. And that becomes an increased risk for lung cancer. Not right away,
Right.
but over years and years and over time.
And probably, I guess what I meant by saying really prevalent in the home, that's probably just because you spend so much time
A lot
there.
of time in your house.
And if it's
Exactly.
not ventilated well, then your
Well-
risk is higher, but then you kind of run into a whole nother set of issues with ventilation with your basement.
So ventilation, generally speaking, ventilation is good, but particularly for radon, ventilation is good because if the radon gas stays down there, the more you breathe of it, the greater the amount of radon you breathe in, and the higher your risk of developing lung cancer down the road. And we can talk about some of the other things that increase your risk even more, like smoking, so that if you're smoking and you're exposed to radon, your chances of developing lung cancer are much higher, in
Right.
fact, higher even than smoking by itself. So you mentioned that the EPA has estimated, and we all agree on this, it's the second most preventable cause of lung cancer in the world and in the United States. And so it's one of the things that we know if we fix it, because if we test for it, identify it, and fix it, we can significantly reduce our risk of lung cancer.
And so we test for it by doing,
So
how will we test for
the
it?
test for it is, remember, it's sitting down in the basement or wherever it's getting into the home. So the test consists of, there are a couple of different kinds of tests. The simplest one is there's a little charcoal device like this, and if you put it down where the radon is most likely to be and you leave it there a couple of days, then the radon that's in the air will stick to that charcoal. You send that off to a laboratory, and the laboratory counts how many alpha particles, how much radon is in there, and they'll tell you what your radon concentration is. And there are other more sophisticated kinds of devices like electronic meters that will actually read the radon on an ongoing basis. But for most people, it's okay to just use the simple test kit.
Okay. And so there was a graphic we had on the screen a couple times about the different areas that radon can seep through.
Yes.
Me kind of knowing a little bit about radon, but not a ton. And for those people who really, this is their first time learning about radon,
Sure.
I thought you could really only be exposed to radon maybe seeping up through, cracks in your foundation.
Right.
Never thought about a sump pump.
Yep.
Never thought about water supply.
Yep.
Where else? Joints that maybe
Any
aren't sealed off.
place a gas can get through, the radon can seep through. So it doesn't take a very big opening. There is construction that's of a type called radon-resistant construction. In fact, there's a whole program to develop what's called radon-resistant new construction. But any time that you have a crack, you can get radon coming through the crack. It does not have to be a very big crack. It can be an invisible crack in some cases.
So if you had an older home, because you want to test for radon if your house was built before a certain time, or it's really just
Doesn't
any
make
house at all.
any house at all.
So new construction
Yeah.
wouldn't be any more at risk than a house that's been sitting there for a longer period of time?
Good question. So radon-resistant new construction, what happens is they sort of build the ventilation and the protection into the house itself, so that even if you develop cracks over time, you've got a way for the radon to be essentially sucked out of the home. In many cases, though, with older homes, or with homes where people have built in the basement or done construction in the basement, anything that you do to alter the foundation or the walls below ground potentially increases the chances that you're going to get some small cracks and ways for radon to get in.
When did this become knowledge, like public knowledge, that this is really becoming a public health
We've
issue?
known for decades. We've known
Okay.
for decades about radon, but I think, you know, one of the things that has happened over time is there's been increased awareness, in part because as we sort of learned more about cancer and lung cancer specifically and smoking,
Right.
we started to recognize the increasing importance of radon as a risk, another risk, a preventable risk. And the other thing is that older homes, in many cases, people didn't spend as much time in the basement, and they didn't finish their basements and spend a lot of time down there. So it's really been over the last couple of decades that we've understood more about both how radon works, what the risks are, and importantly, the importance of testing for radon and then fixing or abating the problem if it's identified.
And then, so say it's identified.
Yep.
You have a radon problem. Now you panic. No.
Well, so
but how do you fix
so there
the
are
problem?
right. No, that's a really good question. So, you know, if I'm talking to somebody in my office or explaining about radon or talking to a community, here are the important questions. First of all, have you tested? And here it's important to think about the fact that just because your neighbor has tested and may have either a low radon level or a high radon level doesn't mean that you know what your radon level is in your house. The only way you know is by testing your house itself, right? Second thing is, we know there are some areas of the state that have higher ground level, the chances of having radon are higher. So if you look at a map of Maryland, and I suspect you have one here, you can see that we've got red zones and then yellow zones on the map, and that corresponds to where we have looked at house tests that have been done and looked at the ground geology. So if you look at the Eastern Shore, for example, that tends to be much sandier and it's lower in the elements that are more likely to produce radon. So the chances of having a high radon level in the Eastern Shore tend to be lower.
Okay.
That doesn't mean, however, that, again, that your house is definitely safe if it's on the Eastern Shore. Still, the only way to test is, the only way to know is to test. And if you look at where we have a band of higher radon level, which goes sort of through the middle of the state, it includes Carroll County and then sort of down in an arc. It corresponds to the geology that produces, more likely to produce radon. And that's a sort of a big swath of the middle and the western part of the state. And there we do tend to see much higher radon concentrations on average. And we've had some homes in Maryland which have had very high radon concentrations. And I'll talk a little bit about what those are. But those are in picocuries per liter is one of the things that you'll see in the report. And so the number 4 is important when you start talking about radon tests. So, and the reason for that is that in the range, so what the EPA has done is look at the risk of lung cancer with breathing radon for an entire lifetime, and then said, so where does that become a problem and where does it significantly increase your risk? So if you test your home and the results are in the 0 to 2 range, then you can be pretty confident that your risks of a significant radon exposure are pretty low, you're doing pretty well. If they're in the range of 2 to 4 picocuries per liter, that's an area where you probably want to test again, and you may want to sort of think about things that you could do there. If it's 4 picocuries per liter or greater, that's where we recommend, first of all, just confirming that with another test, but also that's an area where we recommend remediation oftentimes, or fixing the problem. So the important thing to understand about this is A, you have to test, there's no other way to know. B, you can't tell anything about your radon level from your neighbor's radon level. C, there are areas that we know are more likely to have radon on average. And D, if you do test, then there are things that you can do that are pretty easy to fix the problem.
And then just going back to the map, what you were talking about, location. Harford County is kind of split.
Yes.
So can you talk about why maybe it's, why certain areas in Harford County are higher versus...
Okay, so part of that is geology because of where Harford County is, geologically speaking. But it's also, again, this goes back to if you're living on one side of the line or the other side of Harford County, doesn't mean that you know what your home's radon level is. There's no guarantee if you're in an area that tends to have higher radon levels that your home will necessarily be high. The only way to know is to test.
Right.
And if you're in the area that's low, we still have homes that you can test there where we'll find levels where you'd want to do something about it.
Right. And is this something that would change over time? So say you tested today.
Yeah.
And then are you comfortable with that for the rest of your life, or do you want to test maybe 5 years down the road,
Really
10
good
years down
question.
the road?
Really good question. So if your radon levels are under 4 picocuries per liter and you're not going to do anything about it right now and you're okay with that, generally speaking, we do recommend, and the EPA recommends, retesting at regular intervals. Part of that is because, think of your home, like your body, changes over time, and sometimes it may develop small cracks in the foundation, so it's good to test on a periodic basis. The other thing is if you do construction or alter the home in some way, especially the basement, that's a good opportunity after you've done that to retest as well, because that may also disrupt the foundation.
And then a tip that I learned is if you're moving into a new home, it's optional to have a radon test done. Always pay for the radon test.
Right. No, that's a really, really good point. Radon testing is not required under Maryland law, but we do. I mean, I think it's a good idea if you're buying a home. We did it when we bought our home to do a radon test or to ask for a radon test to be done.
Right. And then intervals, time, you said time frame intervals. What kind of intervals? Every other year, every 5 years,
No,
every 10
every 5 years. If you haven't done anything to your house, it's probably okay to do every 5 years or so, and just, it's because things don't change that dramatically. But if there is a big change, that's an opportunity to retest.
And then, we talked about why it's dangerous, and so can you talk about the relationship between lung cancer, aside from just breathing it in, but your extended exposure, really the actual relationship between the two?
Sure. No, and that's a really good point, because I sometimes when you're talking with parents or grandparents about what the risks are, it's important to know that if because we breathe radon all the time, it has a very small but significant. It's not zero, but it's still small in terms of your risk of lung cancer. So I don't want people to think that if I find radon in my home, does that mean that I'm going to develop lung cancer? No. Let me just be very clear about that. It does increase the risk over time that if you breathe that your entire life at a very high level, yes, it would increase, and it does increase your risk of lung cancer. But nothing that we do says that you're absolutely going to develop lung cancer or absolutely not going to develop lung cancer. People who smoke, we know, increase their risk of lung cancer, but even everybody who smokes does not develop lung cancer. So there are a whole bunch of things that go into lung cancer and to causing that to happen. And it's important to know that for the population as a whole, because we're interested in preventing lung cancer in the population as a whole, the most important thing that we can do is to get people to stop smoking. The next most important thing we can do in terms of prevention for the population as a whole is to have them test and identify radon and reduce their radon exposures in their homes. And particularly for people with children where you may have a finished basement or something else, if you've got that kind of situation, I think it's really valuable to go down and test. And because it's easily corrected and easily preventable, it just gives you a little bit of reassurance that you've done what you can to keep your kids safe and healthy their whole lives.
Right. Is radon, so radon sounds like it's strictly targeted towards your lungs. Is there something, another health issue that radon could potentially cause, or is it really just breathable and
so
lung
remember
disease?
what I said about how it works.
Right.
So when it gets in, it's a gas, so you're not eating it, you're inhaling it, and it tends to stay in the lung, so that that's the target, that's the main target for radon. But you can breathe it in a number of different ways. And one of the questions that we talked about at one point was the question of water. And whether it can be in water. It can, because it can dissolve in the water.
Yes.
And the EPA has looked at, and scientists have looked at the issue of radon in water. So in a case like that, what can happen is if it's in the water and you drink the water and it's dissolved in there, ordinarily that's not so much a problem. The main risk that we think is associated with radon in water is that if you're showering, you get that steam, and then you can inhale that steam with the radon into it. And again, so the lung is the primary target there.
Right.
But it's a lot more complicated than a lot more complicated to test for and to fix. So we tend to focus on the biggest risk, which is radon as a gas in the home and in the basement or other occupied areas.
Right. So the water, can you just explain why that's so complicated to test for water? Like, what's the extent of all of these things that you're saying? It just makes I'm laughing because you just want to crawl in a ball and then never be exposed to anything, never go outside. But now you're not even safe in your home anymore. It's
well,
get in,
and that's
breathe
the
in.
important thing to understand is sort of thinking about, again, this is for an individual homeowner, for an individual parent. What you're trying to do is understand, we live in an environment that has risks and chemicals and other things associated with it. Some of those are unavoidable, and you can't really live without being exposed to sunshine, which is good for you.
Right.
So take the example of sunshine. Again, everybody's used to the idea of being out in the sun. It produces vitamin D, good for us. But too much sun, obviously, from sunburn to melanoma risk, is something that we want to try to avoid. So the idea is, in life, we try to balance the risks and understand that you can't crawl into a ball, because crawling into a ball really doesn't work very well. On the other hand, there are things that we can do that will easily reduce our risks. And in the case of radon, the one thing that we know that really does reduce your risk at very low cost is to test your home for radon and then fix it if it's found in the air in occupied spaces or living spaces.
Right. And then I guess with these topics, so we talked about lead last time, but lead can also be used as a positive in environmental. And is there any positive that we use for radon?
Well, so that's nobody has really nobody's marketing radon for anything. It's not good for sales. And so really it's just a naturally occurring part of our environment. And if you're outside, it's not really a problem because you're breathing it in very low concentrations and it's not really an issue. On the other hand, if you're inside and you've got a house where there is radon, we haven't talked about what you do, but basically to fix the problem, all you need to do is provide a way for the radon to be vented into the atmosphere. So oftentimes what that involves is taking a pipe of some kind and putting it up and out of the house and putting a little fan in, and that just basically blows the radon
Shifts
out.
it out. Would you have to do that in every location? Say you have a crack and you have a sump pump and you have,
Yeah.
somewhere else? Do you have
Yeah.
to do it in all locations, or is it just one area would take care of it?
Generally speaking, it's one area where you can do that, because what happens is that the radon tends to settle in one area particularly.
Okay.
So both for purposes of testing and for purposes of fixing the problem, usually what happens is you look for the area where the radon is most likely to be.
Okay.
So a tip for testing, which is part of the testing booklet, generally speaking, is you want to increase your chances that you're going to find radon. So what you do is you look for the corner where you think the radon is most likely to be. You shut the door so that there's no air moving. You really want to make sure that you increase your chances of finding it.
Okay.
And then a radon professional, if you
Yes.
find radon, can design a system and install a system which will take care of the problem.
Okay. Do you want to talk about, we have a couple minutes, talk about the state initiative? Very exciting, actually.
Yeah.
So go ahead and
So,
do your thing.
so we've been concerned about radon for a long time,
Mm-hmm.
and through a grant from the U.S. Environmental Protection Agency, the Department of the Environment is about to launch a new program where they will make test kits available at no cost to the homeowner to test for radon. And what will happen is that there will be a link on the MDE website. We'll have it on our website as well. And that will allow you to request a test kit. It'll be sent to you. You'll do the test according to the instructions, send it back to the laboratory, and the laboratory will send you the results.
That's such a great program. Otherwise, where would you get tests from? Home Depot or Lowe's or something
So
like that?
tests are available. Test kits are available at most Home Depot type stores, Lowe's, and other stores where you can get home improvement kinds of things. And again, it's a simple test kit. There are instructions that come with it. You send it to a lab and you get your results back.
Okay. Is there anything else that you want to talk about? Any last takeaways before we end the show today?
No, I think the important thing that, simple messages are: one, test.
Yes.
Because the most important thing is to figure out whether you have a problem or not.
Right.
Right? So hiding your head in the sand, or if you've got sand, that's even if your house. We haven't talked about this, but again, it doesn't have to be the basement. If you don't have a basement, you can still have radon in the house.
Right.
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 So number one, test. Number two, look at the results. And if you think you may have a problem, there are professionals who can help with designing and implementing, putting in remediation systems.
Great. And then going to MDH's website and applying for that free
We've
test kit.
We've got that through the Department of the Environment website, the Department of Health website.
Yes.
And certainly if you've got more questions about radon, you can obviously call the Harford County
Yes.
Health Department, or you can call us toll free. We have a number 866-703-3266.
Excellent.
And we can provide additional information.
Okay, great. And we have resources too. Thank you so much for being here today.
Always nice to be here.
That is all we have time for today. I would like to thank my guest on today's show, Dr. Clifford Mitchell. If you would like more information on radon, please refer to the resources page after this program and refer to the phone number. Please join us next time for another important issue that matters the most to the citizens of Harford County. And thanks so much for watching. So that was good.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.